So the right ventricle is just below the right atrium, okay, and it could also get enlarged. So we'll be talking about what could make the right ventricles enlarge, okay, what the patient will suffer from, and all those beautiful stories. So for right ventricular hypertrophy, first of all, definition is a thickening of the muscular walls of the right ventricle, usually caused by what? Pressure being too much or blood volume being too much. Those are just usually the two causes. So what's the function of the right ventricle before we start talking about these abnormalities? It pumps the oxygenated blood to the lungs so that the blood gets oxygenated. So when the pressure in the pulmonary artery rises sometimes, it will be resisting the right ventricle from pumping blood into the lungs. I don't know if you understand. Those are just possible. So what are the causes? Pulmonary hypertension. So if the lungs itself is resisting blood from coming in, then you have blood being overloaded in the right ventricle. If there's chronic lung disease, like all those chronic obstructive pulmonary disease, interstitial lung disease, sleep apnea, called pulmonale, you could have an issue in the lungs. The issue in the lungs will transmit to its connection to the heart, which is what? The right ventricle. The congenital heart disease, like the Tetralogy of Fallot, vascular disease like the tricuspid valve regurgitation, so mitral valve disease, just all of that. What will the patients be suffering from? Shortness of breath, fatigue, weakness, swellings in the legs and ankles, chest discomfort or palpitations, syncope. So they can be fainting on several cases. You diagnose this from echocardiography, electrocardiogram, cardiac MRI, heart catheterization. Okay, so treatment is you treat pulmonary hypertension using all those oxygen therapy, vasodilators. You manage lung disease. So if there's any underlying lung disease, manage it. Then if there's congenital defect or valvular defect, you manage it, like all those ventricular septal defects. Then directives to put out the fluid, quit smoking, maintain a healthy lifestyle, and the rest of it.